one of the basic components of this project is impact evaluation, quality monitoring. Right from the very beginning, for example, the writing of the contracts, we want to be sure that the various service providers really do understand the huge demand for quality, because we run this project in a context where many other initiatives have failed. And before we started the project, we conducted a girls' vulnerability assessment, and that assessment had several interesting findings that have informed various design elements of the project. One of the things we also know is that in most cases where girls are vulnerable and they have first-time experiences on a job, most time they exploit it in terms of sexual exploitation and abuse. So one of the things we engage the private sector is to sign a code of conduct and to provide safe working environment for the girls. So people are taking the necessary steps so that girls are not prey to sexual exploitation and abuse. So we actually make them to sign a rating code of conduct, making the commitment that as long as these girls are within their employ, they have some level of protection against being abused, against being, for example, to work like too many hours or to work at dangerous time of the day. So we engage with the private sector to look at most of these. So it's a way, and when girls are placed, our monitors follow them. They're following them for two basic reasons. One, they want to check and see how the girls are performing on the job or how they're performing in the market. So they go ask a lot of questions. They also engage with the private sector and see whether their anticipation in terms of services, in terms of this various skill set that the girls bring, whether it's relevant to their basic needs they're having. But more so during the training, because there are quality standards that we look out for. We do not allow the service providers to just run the show isolated. So we do weekly monitoring visits. During those visits, we sit and observe the presentations and the methodologies and the way girls are responding to the treatment, look at issues of safety even within the training facilities. We're aware that girls have a lot of concern when it comes to child care, for example, because our baseline survey revealed that 70% of our trainees already have children, and if the appropriate facility is not provided to care for these kids, it hampers girls' ability to attend, to concentrate, and also to complete the training. So we provide child care facilities.